themselves. Additionally, in your clinical role and as a leader in the organization, you will support the approach to the vaccine, which is following CDC and DOHA. I'm assuming someone's name is there. We're going to black that out to protect them. As mentioned, I will be meeting with System Incidents Command leaders specifically to discuss the blank approach to VAER's reporting. Currently, VAER's reporting is responsibility of the provider caring for the patient. So they're clear that you were not supposed to be doing anything. If anyone comes to you, you now have to say, now, what happened when those people that were bringing you reports and you said to them, look, you really now need to report this yourself? How did that conversation go? Do you think they took that on?
No, because it's such an unbelievable task. They just can't. So then what happened was a nurse in the organization started collecting patients that she thought would be patients that needed to be reported, and would put them kind of in my drawer. And then I was supposed to put them in that Safe Connect system. But again, who's going to pay me? Like, this is going to take an unbelievable amount of time. And I even had a conversation kind of with my leadership talking about that, and that, you know, we put these in the system, but where do they go? Who follows up on them? Right. Then how do I know that these patients got reported? Because some of them, you know, again, they directed me not to report on patients that weren't mine. But before that happened, I had talked to some families about their loved ones' cases being reported, and they're waiting for their report. They're waiting for their case numbers, and they're not going to get them. And, right. You know, because I was kind of halted from doing that. So, you know, to put these patients in this system is, again, a very involved process. And who has time to do that?
I guess it would only matter if we cared about the safety of humanity right now and the future of our species. When, you know, earlier on in the show, and you've been here sort of sitting and watching it, there's this discussion going on, you know, the epidemic of the unvaccinated are filling the hospitals. You only have the view of your hospital, but is that your experience, that it's mostly unvaccinated people that are coming into the hospital, or is there, you know, at least some that are vaccinated that are either suffering from COVID? But as you're saying, and that's what I thought was interesting, that phone call, right? He's like, well, we know flu shot, people come in with the flu after. We know pneumonia shot, they come in with pneumonia after it. But that really wasn't a lot of what you're reporting. You weren't reporting breakthrough cases. You were reporting heart problems, strokes, you know, shaking, seizures. I mean, that's different. You're not, you know, it's one thing to report breakthrough cases, but these people are really messed up, right?
Right. And we know the efficacy of the flu and the pneumonia vaccine. We know the efficacy because they went through the full testing and everything. So we know. With these, we don't know the efficacy, which is why that's not a good comparison, because we don't have that data. That's the whole reason we are reporting this stuff, so you know.
So from an inside look, inside of a hospital, what percentage of cases coming in, you know, to ICU, into the ER, these things are unvaccinated compared to vaccinated?
So that is something I've actually been kind of tracking for a couple of months.
Okay.
And specifically in July, I had a particular day where we had 35 patients on our inpatient hospital census just for our group, and 30 of them were fully vaccinated. And out of those, all seven patients in the ICU were fully vaccinated, and 9 of the patients so 9 of those patients were listed initially as unvaccinated. But I went back and checked and talked to the patient, and they actually were vaccinated, so I updated the system.
Wait a minute, explain that to me. So how are they coming in? Why is that discrepancy taking place?
Because on admission, there is no requirement to ask about the vaccine.
Okay.
So, and our system is set up that if you're fully vaccinated in our health system somewhere, one of our clinics, or somebody has put it in one of our outpatient clinics, it'll automatically kind of be put into the electronic health record.
Okay.
But if you're vaccinated, say at some CVS pharmacy or something outside of the system, that's not going to be automatically put in that system unless you ask.
Okay.
So it'll list you as unvaccinated in the system.
Interesting.
So you have to, you know, again, it's not a question on admission that is asked. Even if, you know,
which is crazy.
Yeah,
in
it's
the
not
middle
asked.
of an emergency use authorization situation.
Right. So what I would do is then I would ask my colleagues who had those patients, hey, ask them if they're vaccinated, or the nurse, ask them if they're vaccinated. And then if they are, we'd get their information and we'd update the system.
Right.
And so I updated the system for that day.
7 of 9? Where does-
Nine of